Hi everyone, I'm Dr. Ara Shahraban, endodontist, oral epidemiologist, and professor in the endodontics department at Kerman University of Medical Sciences. Welcome to my channel. Whether you are here for the latest breakthroughs in dental research or practical tips to level up your practice, you are in the right place. Let's dive into the fascinating world of dentistry together. Today, we are diving into some of the most exciting articles from endodontic journals in January 2025. Whether you are an endodontist, a general dentist, or a student, there is something here for everyone. So grab a coffee, get comfortable, and let's explore the latest in endodontics together. It's been a while since my last video, and I want to apologize for the long gap. Life gets busy, as we all know. But moving forward, I'm committing to sharing new videos more regularly, aiming for at least one every month. As clinicians, we understand how crucial it is to stay updated in our field to deliver the best care possible. In my opinion, evidence-based medicine is the gold standard for staying informed and ensuring our practice is grounded in the latest and most reliable research. Let's keep learning and growing together. In this video series, I handpick the most recent and impactful endodontic studies from top-tier journals and break them down into concise, easy-to-understand summaries. I know how hectic life can be for us clinicians, so my goal is to create short, informative videos that help you stay on top of the latest advancement in endodontics without taking up too much of your time. I hope these videos become a quick, go-to resource that adds value to your practice and keeps you in the loop. The first article I want to share with you today is one that's close to my heart. It's my own research, published in the Iranian Endodontic Journal in January 2025. Alongside my amazing colleagues, we conducted a study titled Correlation between the Mid-mesial canal and forcation radiolucency in mandibular molars. In this study, we analyzed 400 CBCT scans to explore whether there is a correlation between mid-mesial canals and forcation radiolucency in mandibular molars. And the result? They were pretty striking. We found that in first and second molars that had undergone endodontic treatment, forcation radiolucency was 12.7 times more likely in cases where the mid-mesial canal was missed compared to cases where it either didn't exist or was properly treated. This is a huge correlation, and it really drives home how critical it is to identify and treat mid-mesial canals during endodontic procedures. Alright, let's dive into another fascinating article that uses CBCT imaging in endodontics. This study, conducted by Jadhav and Mittal, was published in Journal of Endodontics, and it explores the correlation between proximal caries and pulp canal obliteration, or PCO. Here is what they discovered. 47% of patients with proximal caries showed pulp canal obliteration. That's almost half of the cases. When it came to mesial proximal caries, the distal root canal had significantly more PCO. On the flip side, in cases of distal proximal caries, PCO was more common in the mesial canal, and here is something really interesting for me. Also, the study found that females were significantly more likely to develop pulp canal obliteration compared to males. These findings are pretty eye-opening. They show how the location of caries can directly influence the pattern of pulp canal obliteration. Plus, the gender differences in PCO raise some intriguing questions that could open up new avenues for future research. It's studies like this that remind us how complex endodontics can be. Next up, let's talk about a study by Kang Seng and his team published in International Endodontic Journal. They conducted a retrospective study to compare the success rate of root canal treatment using two different approaches. One group used a calcium silicate-based sealer with the cold hydraulic condensation technique. The other group used an epoxy resin-based sealer with the warm vertical compaction technique. What did they find? Well, the success rates between the two groups were pretty much the same. No significant difference there. And when it came to sealer extrusion, the numbers were similar too. 27.6% for the calcium silicate-based sealer and 36.2% for the epoxy resin-based sealer. Here is something cool. At follow-up appointment, neither sealer showed complete resorption, which tells us that both materials are stable and reliable over time. So, whether you use calcium silicate or epoxy resin, this study suggests that both can get the job done effectively. Sangman and colleagues published a paper in the International Endodontic Journal focusing on pulp sensibility test in the context of vital pulp therapy. As we know, the primary goal of pulpotomy is to preserve pulp vitality, but the assessment of pulpal status after the procedure is often overlooked. Their study revealed some interesting findings. Teeth treated with partial pulpotomy responded more predictably to electric pulp test and cold test compared to those treated with complete pulpotomy. They also emphasized that a combined positive response to both electric pulp test and cold test should be considered when assessing pulpal status after complete pulpotomy and partial pulpotomy, as this approach provided more predictable results than relying on either test alone. These insights highlight the importance of using multiple diagnostic tests to accurately evaluate pulp vitality after vital pulp therapy. Alright, let's talk about this study by Sulek and his team published in Journal of Endodontics. They wanted to compare two types of anesthesia, mental incisive nerve block and inferior alveolar nerve block, for mandibular first and second premolars with symptomatic irreversible pulpitis during root canal treatment. Here is what they found. Both mental incisive nerve block and inferior alveolar nerve block worked pretty much the same when it came to pain control for these teeth. But here is the catch. Mental incisive nerve block wasn't as effective for second premolars compared to first premolars. Now, here is the interesting part. Even though both techniques had a 70% of success rates, the study suggests that you might still need supplemental anesthesia to really pain management in these cases. It just goes to show how tricky it can be to manage pain in teeth with irreversible pulpitis. Alright, let's talk about a study by Ertork and colleagues published in Australian Endodontic Journal that looked at how troughing affects the detection of MB2 canals in maxillary molars, both with and without calcifications. They studied 200 molars, and here is that they found. When they used troughing, they discovered 16 more MB2 canals, bumping up the detection rate to 91%. Pretty impressive, right? But here is the catch. Troughing worked really well for non-calcified MB2 canals. But it didn't make much of a difference for calcified MB2 canals. So, what does this mean? Well, troughing is a game changer for finding MB2 canals when there is no calcification. But if calcification is present, it might not be as effective. It's a great reminder that we need to consider calcification when planning our endodontic treatments. Let's talk about this cool clinical trial by Lee and his team published in International Endodontic Journal. They tested a new fully guided system to make tooth auto-transplantation more predictable. Basically, this system helps dentists place the transplanted tooth in the ideal position using super precise data. And guess what? It worked. The guided system made it way easier to get the perfect placement, which is a big deal for restoring function and aesthetics. But of course, there were some limitations. The study didn't fully address how to design the optimal location for transplantation in every case, and the equipment needed for this system might not be available everywhere. So while this is a really promising step forward, we still need more research to figure out which cases are best suited for these guided systems and how to plan the perfect location. Alright, let's break down this study by Blanc Goncalves and his team published in Journal of Endodontics. They used high-resolution cone beam CT to check out the anatomy of the MB2 canal in maxillary molars, and here is what they found. The MB2 canal was present in a whopping 90% of the cases they looked at. When it came to the anatomy of the mesiobuccal root, the most common configuration was type 4, followed by type 6. So what does this mean for us? Well, it's a great reminder that MB2 canal is a super common, and we needed to be on the lookout for it during endodontic treatments. Plus, knowing the most common anatomical types can help us plan better and avoid surprises. Let's dive into something super futuristic: robotic arms in endodontics. These stable robotic systems are designed to perform super precise procedures, minimizing errors caused by things like visual obstruction, fatigue, or even hand tremors. Basically, they are here to take precision to the next level. In 2024, Isofi and his team made headlines by publishing the first case reports of robot-assisted endodontic microsurgery. Leakin and colleagues published a case report titled Robot-Assisted Endodontic Retreatment, a case report with clinical consideration in Journal of Endodontics, showed how robotic technology was used to successfully retreat a mandibular second premolar. The results were impressive. Robotics proved to be both effective and feasible for this kind of procedure. This opens up a whole new world of possibilities. With enough inter-arc space, this technology could be a game changer for endodontic treatments in other teeth too. The future of endodontics is looking pretty high-tech. Thank you so much for watching. I hope you found this exploration of new endodontics article as fascinating as I do. If you enjoyed the video, don't forget to like, subscribe, and hit the notification bell to stay updated on future content. Your support means the world to me and helps keep this channel going. Feel free to share your thoughts or questions in the comments below. I'd love to hear from you. Thanks again, and I'll see you in the next video.